Okay, come. Show me your problem. Tell me your problem. Type the problem, or if you think it's too long to type, you can type MIC. So I will unmute you. Come. Show me the problem. Show me the problem. Okay, wow, thank you, Simpson. Okay, Sim. Jinlong, I have this problem for 2 weeks. I'm trying to find the root cause of the problem. That's good. You guys, you have to, you see, this is the difference between people and people, you know. Some people, when they see a problem, they make it become a reason to stop or a reason to stop exploring. But some people, when they find a problem, right, they make it a reason to continue to explore. Amazing. I'm trying to find the root cause of the problem. Painful in my body, arm, shoulder, tingling, inflammation in my both arm and shoulder worse in the night. Pain, feeling like sharp poking in my arm. I sleep in air conditioner because my body warm at night. I cannot sleep well and wake up 3 a.m. every night. I recovered frozen shoulder in January this year. I've been regularly patching S39 Eon for 10 months. Then my arm and shoulder pain come back again in May this year. So I went to see TCM, see Chinese doctor. The TCM doctor did cupping on my arm and shoulder so badly painful until blue black in my arm, shoulder after 2 weeks swelling subside. But still my arm still pain. Why you never ask me? Guys, whenever you put a patch, right, if you don't know why the pain come, right, you don't go TCM first. Now the TCM also don't know one, you see. After you do all the cupping, all the acupuncture, it's the same thing. Let me explain. The TCM doctors right now, right, practically has no practical value already because the cupping and acupuncture work on certain basis. It work at the basis that the qi is moving. You get the idea? You don't have too much of dampness. Okay, because when you are doing the cupping, right, although you are releasing, either if you want to do some microneedle to suck up the blood clot, or you just want to remove the dampness, right? But most of the dampness is not just those areas that you do the cupping, right? And the skills of the TCM doctor nowadays is way too textbook already. Okay, so don't, guys, if you have any healing crisis, if you think don't know why you got this kind of problems, right, come to Zoom. Okay, come to Zoom, no need money, want to know. You go and TCM, painful, all blue black, and the pain still the same. I tried ISO and Eon recently. ISO and Eon doesn't help. My LifeWave partner told me this just started 1 day ago. My LifeWave partner said to do this. This patch helped to get my chi flow into my body system. Yeah, he's right. Okay, come. Simpson, can you unmute yourself?
Okay.
Hi, Simpson.
Hello. How are you?
Hello. Very good. Been a while,
Okay,
yeah?
good.
Since
Yeah.
we got last meet. Okay.
Nice to hear.
For the past 10 months, right? Although I know you shared before, can you just do a recap for the past 10 months? Before all this crisis happened, right? What are the biggest changes that have happened to you?
Changes.
Yeah. Or improvement. Yeah.
Improvement is as what you have shared before. My
Yeah.
skin, everything is perfect and good. I mean, only this part pain, but my mistake is that after I recover from shoulder, frozen shoulder, I went to play ping pong. Still continue playing my ping pong. So
I
I
see.
see then it started to get worse again. So I try
I
to figure out.
see.
Yeah.
I
Yeah.
see, I see.
Okay.
Okay. Okay. Do you find okay for the patching experience, right? Do you find your sleep getting better, your appetite getting better, energy getting better, bowel movement, your hair, your nail,
Yeah. Okay. Everything is fine. Everything. I don't have heart problem also. Only thing is my sleep. Recently, my sleep, when I start to patch the ice wave and what you recommend, he
yeah.
did well, no? I can sleep. No? Then after that, I don't the sleep come back again, the problem come back again. I can't I'm wondering why, that's why I switched to so I asked my life partner and he told me maybe you try this, That's why I'm trying to that's find the root
Okay.
cause. Yeah. Yeah.
Okay. So see if I understand the thing correctly, yeah. So you use the patch and then 2 weeks ago you start to have painful
Mm.
all over the body.
Yeah. Yeah,
Okay,
like
and
poking, no, like poking on my
poking
arm, no.
all
Yeah.
over the body, yeah.
My arm also
I
and the
see.
tickling sensation on my knee and all on my feet
all
and
over
all
the
that.
body, all over
Yeah,
the
yeah.
body. Okay.
Uh,
So for something that is all over the body, right, there must be something that affected all over the body last time. Okay. Number one is full body shock like accident. Number two is the full body anesthesia or all kind of medicine or therapy that affected the whole body. Do you have similar experience before?
no, no, no.
No,
Yeah.
no full body anesthesia. Don't have the accidents,
No, no, no.
Okay, so
I'm fine. I'm fine.
are you someone who are really active in sport that you always play some contact sport, you will always have body contact when you even when you were young? Sorry?
When I'm young,
Yeah.
yeah, maybe I run and all that lah, running and so on, but not that rough, not that rough sports. I don't
Okay,
enjoy. Only play squash and all that lah, squash and all
okay.
that.
Squash I think is fine. Wait arm shoulder. Okay, do you have any yeah, but squash is a Nico David is called squash, right? Is it the
Squash,
squash
hitting the ball to the wall.
go around, right?
Yeah, yeah.
Okay, so all the pain that you are feeling right now, right? Last time when you play squash, even the time where you play really very hiong, and does this area have pain before?
Can't recall but I don't think so lah.
I
I
see.
don't think
Okay.
so. Yeah.
Okay, so these are the most probably the reason. Number one, you got full body anesthesia, you got an accident, or you last time you have an old injury due to sports. Okay, but it's okay. But I think that now is definitely a good sign because before this all pain happens, right? Did anyone commented Simpson you look better?
Yeah, of course. Yeah, yeah.
Of
Yeah.
course.
Yeah.
Oh, of course. Oh my God. Okay, do you find that the skin complexion getting better, the sleep getting rosier? You feel that your body feel warmer?
Yeah, what you say is true. Everything is true.
Yeah,
Only thing
okay.
is, yeah.
Yeah. So with all these things getting better, right, it means that the circulation is getting better. So the body have done the fundamental already. Now it's look for all kind of old problem and old injury. I think
So
the
you're saying
body,
it's healing crisis, is it?
yeah,
Are
this
you
healing
saying?
crisis. Yes, yes, yes. So you see you have body, arm, shoulder, tingling. You got full body pain, right? Okay, if someone have one area of pains, okay, that is easier to understand. Maybe you overuse the shoulders, right? But for people who are overall pain, always have the three reasons that I show you just now. So this is definitely healing crisis. You don't need to worry about this. Give it some times, it will slowly subside. Okay.
How about my arm? The arm, I can feel it every time now and then. It's always the pain there.
Okay.
What do you
Okay.
think?
The most painful spot, you can try putting. You have carnosine with you.
Yeah, yeah.
Okay, you can put a carnosine at the point of pain, following the acting quick fix.
Behind the neck, is it?
At the point of pain.
Which page you are referring to? The one.
Yeah. Okay. So this one.
Oh,
So if putting the point of pain, this is just for the reference, the diagram. So you put at the point of pain. So when you raise up, so the area that you feel painful, right? Then you put the patch there.
how about this side? The arm here, the arm,
Wait,
the arm
wait,
here.
wait. Let me show you a video. Okay, again. You show again.
Yeah, here. Around here.
Same
Can you
thing.
see?
Oh, okay. If this pain is more for bicep,
Yeah, bicep there, yeah.
Oh, then I don't think it's a tendon or things. I think this is just it's a lactic acid.
Wow, see, when I lift up, I can feel the pain. See,
I
I lift up the
see.
whole thing. The whole,
This one,
this part pain.
okay.
Whole
I
part.
think carnosine can help also. So you can put carnosine at the point of pain.
Oh,
Yeah.
okay.
This pain come together with your all body pain, right? The full body all pain come together, right?
No, only this part. And sometime only I can feel it in my
Other area lah.
leg. Yeah.
I
Sometimes
see. Okay. If
not
only
pain,
at the
but
area,
thinking sensation. No,
sensations lah.
yeah.
Okay. I think if really focus on the bicep, I think your bicep might have some overworking or some overuse, but not enough rest before. So they might have some lactic acid built up. You put carnosine right now. You put carnosine right now and drink some water.
Okay.
Okay. You try it now. But I want to answer your wake up at 3 a.m. every night. So when did you start to have this 3 a.m. wake up?
Last 1 week ago only lah.
Or last 1 week ago lah. Okay. So if guys, if People wake up
I
at
take
3.
my carnitine, huh?
Okay, can go ahead. So guys, do you remember if anyone wake up always every night at 3 a.m., what is the reason? If everyone wake up at 3 a.m., what is the reason? What is the organ is being repaired? Which organ is being repaired? Fantastic lah, it's lung issue. Okay, so later we are going to check with Simpson. So Simpson,
It's here, right? Can
okay,
carnitine.
yeah, is it the most painful spot?
Yeah.
Okay, you put it patch. Yeah, put the patch there. You put it patch and drink some water. Okay.
Okay.
Okay, so while you're going to drink the water, Simpson, if you wake up at 3 a.m. every night for the past 1 week, right, it's a sign that you are healing your lung. Do you have any lung injury before, lung problem before?
No, I'm perfectly healthy. Yeah.
You're healthy,
No.
right? So,
Yeah.
okay, do you have any asthma before? Do you have what do you call after the COVID vaccination, you start to have breathlessness?
Zero. I'm
Don't have
very.
all these,
Yeah.
Okay, do you have constipation?
Constipation off and on. Off and
I
on.
see.
Yeah.
So do you find that for the past 1 week your constipation get better? At
Yeah.
least,
Yeah.
right? Okay, so this is how it works. So if you wake up at 3 a.m., right, 3 to 5 is a healing of lung. Lung, if people got lung problem, example, I think yesterday or 2 day before, right? Yesterday. The same gentleman, Ricky, also wake up 3 a.m. every night. And then we say got lung problem. He said, I got no lung problem. So then as the conversation goes on, right, he said that my liver got the I think tumor or certain cannot say tumor, certain growth lah. And then it affect my lung. So my lung got water. You see? This always right. If you wake up at 3 a.m., right, it's always lung problem. But if some people the lung don't have problem, then it's the lungs cousin problem, which is who is the cousin of lung? Do you remember? Who is the cousin of lung? Whenever if you wake up at 3 and then I say if lung got no problem, definitely the next people got problem. What is the problem, guys? Who is the cousin of lung? The cousin of lung is large intestine. So if your lung got no problem, really no problem, then the next not so high possibility, but it can be healing for the bowel movement. So if you also say that for the past 1 week, yeah, for last 1 week, quite my bowel quite smooth, it means that now it's really treating your constipation problems already. Amazing, right? Fantastic, right?
Yeah.
Amazing, right? Okay, so now I want you to feel your arms and see how do you feel.
Slightly pain.
Slightly pain or slightly relieved?
Still the pain there, slightly pain.
Okay, so compared to before the carnosine, how many pain reduction you have seen?
Fair.
Yeah, compared to just now.
Asking me the rating, is it?
Yeah, rating. Just now is 100%, now reduced to how many percent?
Maybe 20% or so.
Reduced or left 20% lah.
No, now it's about
Reduce now.
around 50%, not 20%.
Or 50% lah, Okay lah, good enough lah. Not only 10 seconds only mah. Later you will see get better. Okay. So the thing is, if you put carnosine immediately it work, right? It's definitely soft tissue damage. You really overuse that already. But it's possible lah because you play ping pong with your right arms, right?
Yeah.
Yeah, so it's possible because every time when you smash, right, you always overstretch your bicep, man. I am also ping pong player. My mom is a representative for Malaysia table tennis competition.
Wow.
So you are using the horizontal one or the vertical one?
Horizontal one.
Oh, you're doing the horizontal one. Yeah, then I because horizontal always overstretch the bicep, man. Even when I was young, I also overstretch my bicep, especially when you do the what is the name already? 弧前球, you know what it's called? 弧前球? 弧前球 means you really spring the ball. So the one I think very likely.
Spin a lot. Yeah, spin a lot.
Spin a lot, right? It's spin.
Yeah.
Okay, so those things is exactly how you are overusing this area. Amazing, right? So now it's healing. Don't worry. When this one repair already, right, you can continue to play your tennis for 50 years already.
How about my LifeWave partner recommend to put for this I think
Ice
I
wave,
sent
right?
to no, she say put this EE and X39 and E on my back on the neck. Then you see my notes there, what you wrote there? Yeah.
You didn't say leh. You only say about X39 leh. But it's okay, whatever, because you have used for about 10 months already. So follow your upline advice is perfectly fine. So I just want to let you know the problem you're having right now is a healing crisis. Don't worry. If you go to doctor, if the doctor will not ask you anything, just give you acupuncture, go and cupping. I tell you, no one cup muscle one. No one do cupping of muscle one. Stupid doctor.
Oh,
Okay, it's okay. Okay, thank you so much. So don't worry. You just continue to patch. Even you wake up at 3 a.m. is fine. You most likely, if even in the daytime, even you wake up at 3, you don't find very tired in the daytime, right?
no.
That is fine. So that means that the body is really doing the work. This is why your rest is not being disturbed.
Oh,
Okay?
okay.
Okay, thank you, Simpson. Take care.
Thank you.
Thank you. Welcome,
Yeah.
welcome.
Bless you. Yeah.
Yeah, thank you, thank you. Wow, still receive a bless, not bad. Hey guys, is it amazing or not? Okay, is it amazing or not? 3 a.m. wake up always got lung problem. So yesterday the lung got water retention. Okay, if people really say lung no perfect, no COVID-19 symptoms, no vaccination side effect, right? Then is the cousin, which is the large intestine. For sure, these people is healing that intestine. He must have constipation before. So he said, yeah, last time, yeah, my constipation, my bowel not so good, I got constipation. Then for the last 1 week, since you wake up at 3, do you find that last 1 week your bowel movement get better? Yeah, my bowel movement is better the last 1 week. Amazing or not? He even give me a thumbs up. Amazing or not, guys? If you think, oh my god, it's really fortune telling, you type 555. You think, oh my goodness, sure, bro. Wow, he never talked to me about constipation. He never talked to me about bowel movement. He never talked to me anything about the shits. But we know that he got constipation last time. Amazing, right? This is how the TCM should be working. It's not like this. You got pain, acupunctures lah. You got pain, cupping lah. Cup already, all the bruises, even worse lah. You see now through the explanations, right? Oh, so he play ping pong. You see, he play ping pong. Oh, now because when you play ping pong, even you stretch your arm this way, right? You will always feel the tension in the bicep. Maybe you want to spin the ball too much already. You overstretch the bicep. So there's always injury over there. So when they put the pad here, goes so painful. This is how magical life it is. Okay, your Henry, Jinlong sound only. What is the meaning of Henry? But Henry, I know yesterday you asked something, but you left already. Henry, can you unmute yourself, Henry? Henry, can you unmute yourself, Henry? Okay, Irina, Jinlo, I have a new downline colleague who will be asking questions for his brother who is having chronic kidney disease and need advice as doctor asked him to start dialysis. But after I intro him the patches, he want to try the patches for his brother. I told him to use X-Ternate Eon. Yes, you are right. It's the right pack. He's still at work and should join shortly. Thank you. So sure, Irina, can you let me know when he is here? Why why blood pressure can be yo-yo? Can it be healing crisis due to certain issue?
Jin Long, sorry.
Okay, Henry, it's okay.
Yep.
Come. How can I help you?
No, you see, I say sometimes I wake up at 2 a.m.
Yeah,
Sometimes I wake up, but I still can go back to sleep
yeah,
and then wake up again at about 5 or 6, you know,
yeah.
the kind of thing. I used to have this kind of problem after the patch. First day when I use it was okay, but now give me again. And my upline say that it's my liver got a problem. What do you think?
Yes, you are right. So if normally from 1 to 3 a.m. you wake up, right, it's always liver problem. Are you someone who take a lot of supplements or medication?
I'm taking one type of medication which is for my feet. The feet. Yeah, but I was thinking whether I can don't take at all.
I
Like
see. Okay.
epilepsy later.
I
Epilepsy.
Oh, you have epilepsy. I
It was
see.
after my stroke. 我有中风，以前没有
I
中风的时候
see.
没有的。我中风后第一次是有 stroke，有那个 epilepsy。我去问医
I
生，
see.
医生为什么这样？医生说非常common，因为说中过风的人
很多会都有这个epilepsy 的。
Okay, Henry, do you mind to speak English? Because today English session. Okay, but let me translate for you first. So Henry having the fits the epilepsy after he got stroke. So he's taking only one medication. Okay, Henry, can you speak English?
Yes, I can.
Can okay, can. So Henry, how long have you been using LifeWave?
Only recently, only less than a month. I think in
A month.
July this year, I just do because my friend who is my sponsor say, hey,
Yeah.
why don't you try this? Because maybe it will help you also to get you stronger so that later on you can walk. So I say, well, okay, why not? I got a chance to make myself better. Why not?
Yes.
Because he told me because this patches also build out your stem cell. I said, oh, build my stem cell, good one.
Yeah.
Stem cell is what we our body need one.
Yes.
So I guess I give you a try. So I give you a
Yeah.
try. I see what will happen.
Right.
With that,
Right.
it will build up my strength and everything. If I can, and my stem cell go higher, and my body can walk, I think that will be a miracle. Then I can share with
Amazing.
everybody. Then I can share with everybody. Say, hey, look at me. Now I can walk here.
Wow, amazing. Okay, wait. Just now you said the last sentence is now you can walk already.
No, not yet.
Oh, not yet.
But I know
Okay.
my leg got a little more strength.
I see. Okay. So for the past 1 month, for you use the patch, right? What are the bigger changes that you have seen? So number one, your leg have more strength. That mean you can start to lift up your legs a little bit already, right?
Yeah, a little bit.
Okay. Yeah. Okay. So now you can lift up a little bit. It mean your lower back getting stronger already. So the
Yep.
next thing that you are going to see is okay. You are doing left side or right side? Which side
Left hand side.
is
My
the left
left hand
side?
side after the stroke, my left hand side no feeling,
Yeah.
no control, nothing. But now the feeling came back. Unfortunately, no control.
Yeah, it's okay. It's okay. It's like this. When the control come back already, later you can start to control a little bit. It always come a little bit. When you can start to feel already, right? It means that the blood starting to go there already. Then
Yeah.
next stage, then you can start to control the movement. So they mean is after the patch, your leg got more strength, and then you can start to feel your left side a little bit already. Can I say like this?
Getting stronger. Last time you touch also no feeling at all. But now it's getting back. The feeling is getting stronger.
So they mean when you touch your left hand, you can feel something, right?
Yeah. Last time
This
I tell you pinch until the person who pinch me also tell you say, "Can be so funny one, no feeling one." I say, "No, I don't feel it because my after the stroke, totally no feeling. But now you pinch me, you hold there, and then I can still feel a bit. But
okay.
now it's even stronger."
Wow, amazing. Okay, so this is a good thing. Anyone say you look better? Henry, like for example,
I haven't seen anybody
haven't
yet.
seen. Okay, or haven't seen. No wonder. Did you find that you can speak better? Let's say you got less
I think
drooling.
so.
You think so, right? Amazing. This is the best news for you right now, Henry. What you need to do right now is have patience. They are going to be healing crisis. If you wake up and then you sleep, because this is how the body is doing the work. When the body want to heal at certain timing, right, you just need to wake up because the body is too active already. If you wake up at 2 a.m., it's always the liver problems. Do you find that for the past 1 month, right, you find that your nail is growing stronger? Is your nail
Yep, it is going stronger.
going stronger, right? It means that
Yep.
your liver is really being cleansed right now. So this is why you wake
Oh,
up at 2 a.m.
that's what my upline say. Your liver got problem. I say, I don't think so. I say
Yeah.
maybe could be because I'm taking the epilepsy medication. It could hurt my liver because every year before I see my doctor will do me ask me to go do a blood test. You know, see
Yeah.
how the level of
Yes,
the
yes, yes,
medication,
yes,
whether
yes,
how much it's gonna affect me. But all the
yes,
while when I see him, I do the blood test. All the while was okay, no problem. So
yes.
thinking
So
then, saying you tell me no
yeah,
problem. Can
yes,
I
yes,
stop
yes,
it or not stop the medication? But I worry that if I stop it, the fit came back because the fit did not come back for almost 3-4 years already. That's why the
I
doctor also
see.
blur. I said, why you so good one? Because all the while when I have all these things, I nonsense. I'm different from people. People when they go for I also in doing secondary 4, I was diagnosed with diagnosed as ALL.
Yeah.
And then they give me chemo and radiotherapy.
You mean ALL or ASL?
ALL,
What's ALL?
acute acute lymphoblastic leukemia.
Oh, leukemia. Oh, okay. I thought you were talking
The white
about
blood cell, the white blood cell go too
muscular
high.
I see. Okay.
And then after when at that time, I was so weak. When I go up a prayer staircase, I was panting like nobody visited. So my dad said, "You better go and see another GP." And when I go and see her, she go and do a checkup and tell me, say, "Hey, your liver very hard. You better go to be awarded at the hospital." And that's what I did. I went to
You see?
GH.
You see? This is what I'm saying. This is what I'm saying. They mean your liver sure got a problem. This is why that you wake up at 2. The body never lies. So even the doctors, when he try to, try to tell you your liver got no problem, it means that the problem not yet so serious until it can detect from the blood. But I have something even cheaper medical device. It's using your eye to look at your nail. If your nail now growing stronger, harder, it means that now the liver is getting better.
Yeah, it's getting harder.
Harder, right?
And then it grew faster also.
Faster, right? It means the liver
Yeah.
getting better. Last time your nail very soft, right? Maybe easily flake off, right? Leave it torn, right?
Yep.
Yeah, you see?
Sometimes I can peel it off.
Yes,
A few
and now
times I got peel. I peel it off. No choice because he came out a bit, and then he sort of like split up. You see, so I had to wait. Either I wait for my brother to cut it away, or I only should buy it out. Lor. No
amazing.
choice because it's very very disturbing. But now I know it's very hard. No way I
Wow.
can buy.
My goodness, I'm so happy for you, Henry. So now you're on the right track already, and you had to thank your upline. Your upline is giving you the right information. It's really the liver. Although the doctor say your liver got no problem, but the history of your liver issue, it accumulated. Your liver, our body always have the memory one. So now the nail growing stronger mean the liver getting better already. I don't know now, but soon you are going to see baby hair already. Do you see you start to have less hair loss or start to grow new hair, baby hair?
For a while, I don't have hair loss.
Okay, okay,
But because now I got operation on the head,
right.
the portion where they operate on no grow, the hair won't grow on.
Yeah, they decide it will be take some time, but don't worry. When your liver can get better, the nail grow stronger, right? Maybe the part is okay, right? You will start to have more baby hair, but this one come later. So now, even you wake up in the middle of the night, we let the nature take its course. Is how the body heal itself. Don't need to worry and go and take TCM lah, acupuncture. No need. You are not having problems. It's a part and parcel to get the better.
I know. I never go out acupuncture.
Okay, amazing. Okay, Henry, thank you so much. Okay. Thank you, Henry.
Thank you. Because when I
Bye-bye.
want to talk to you, very difficult.
I
You're
see.
very
Why?
busy. My other say, you don't talk to Jinlong very busy, but don't disturb him. Then
No lah,
luckily,
can.
I said,
Can.
well, you got Zoom. And I said, that's the only good time I can talk to you.
You
Or I
are
share with
right.
other
You are
people,
right.
and hopefully other people heard about my story. They just
Yes.
say, oh, they got more confident. They say,
Amazing.
hey,
Wow,
this
amazing.
is product I can trust. I was
Amazing.
trying to tell them, say, if you don't trust, then I can't do anything because I know some of you may not have any effect, or because your body, each of us, our body work differently. Some of
Right.
them, when you patch, immediately you will feel the effect. Some of them, have to wait for maybe 1 month or even 1 year, then you feel the effect, or even longer.
Amazing.
But you must be patient because this thing really work. But you need to you must be patient. Like tell
Yes.
you, when you do fishing, you must be patient. Then the fish will you can only then you can take out the fish from the water. If not, you don't even give it a try, we got chance.
Yeah. Okay, thank you so much for your story, Henry. I will move on to the next question. Okay, thank you so much. Thank you. Even you use for 1 month, you really become the light for others already. Thank you.
Welcome.
Amazing or not, guys? Huh? For someone who got the stroke or the epilepsy after 1 month's time, can start last time got no sensation, no sensation at all. Now can start to feel when people touch his skin, and he start to feel that the body gets stronger. Okay, he wake up at 2 a.m. 1 to 3 a.m. is always liver detox. So 2 a.m. wake up is liver getting better. When the liver getting better, how you see the difference is the nail will grow stronger. Exactly right. Just now the case for Simpson, you wake up at 3, either lung or large intestine. So the constipation get better when you have the healing crisis. These cases wake up at 2 a.m. as a healing crisis. As a result, the nail grows stronger because the liver cleans faster already. Do you think it's amazing? Do you think that our Chinese medicine is able to analyze how the body works in these kind of details? Is amazing? Amazing, right? I really want to have this kind of renaissance. Okay, we Chinese, we have a lot of this kind of depository of knowledge. It's just that because we know it and we think we know it, so we abuse it, right? And this is a sad thing of life. Chinese is the one who know the most about the body because of the Chinese medicine, but we are also the race who violate it the most. We all know very well that what is the repercussion of staying late and then you sleep very late. But Beijing, Shanghai, China people is the one who sleep the latest. Yeah, but it's okay. It's okay. I believe time is going to come. Okay, Osh, Jinlong, before sleeping, leg put on warm water 20 minutes. Same as patch. What type of patch? I don't understand what you mean. Okay, Osha, can you unmute yourself? I don't understand what you mean. Osha, can you unmute yourself?
锦龙，
哎，来，什么意思啊？Okay, sorry, English. What do you mean?
泡脚啊。
Okay.
That's we use the patch is that got the same type of this 怎样讲啊 ？Same type of this.
Oh, I see. Cannot compare. Patch is much better because when you do a foot bath, right? Even you use all kind of herbs all kind of ginger, serai, right? It only improve the circulation from the bottom down. And the reason why people say foot bath is good for sleep is because it channel the yang energy to the bottom of the feet, which is the kidney 1 acupuncture point, so that the kidney start to recycle back the yang energy, and then it become in for you, so it's more relaxed for you. But that is how it just improves circulation. But LifeWave not just improve circulation, it heals you. It signals your body to do the healing like the younger days. You cannot compete. We cannot differentiate that. Foot bath equivalent to what kind of patches? It's like you are asking me using a bicycle. Is any car in Ferrari is the same like driving a bicycle? It's not. It's incomparable. Osha, it's incomparable. Okay. Okay. Let me see. But anyway, if you really want to try, okay, after you use for at least 6 months, you can play around with the patch, right? You can try energy enhancer at the bottom of the feet. So for those of you who feel that when you do a foot bath, right, you feel better, right? You can try energy enhancer putting at the bottom of the feet, okay? Because it might because the young energy is not going back to the kidney. Especially for people who overthink. Okay, sorry. Why brain partner, why blood pressure can be yo-yo? Can it be healing crisis due to a certain issue? Okay, if blood pressure yo-yo up and down, right? And yet you don't feel any dizziness, is a healing crisis. Most of the time it's healing the kidney. Okay? Jinlong, what to patch for anosmia? Anosmia, is it the sensory, the smell issue? Wait, yeah, you're right. So, okay, so for losing or smell, right, there's no guarantee, but we do have people after putting the patch, right, he can now start to smell pungent thing. They mean the normal thing he can't smell yet, but he can smell chili, he can smell those kind of patai, he can smell durian, those kind of very pungent smell, he can start to smell already. So really need to patch, and sometimes we have to compare with other options, right? No any other option better than LifeWave. If LifeWave can't work, right, nothing else can work already. Okay. So, and also for restless leg syndrome. Oh, okay. If restless leg syndrome, if it is not because of stroke, not because of any surgery side effect, right? X39 Eon, when the digestion get better, the muscles start to grow, the restless leg syndrome, it will disappear. All kind of muscle degeneration, muscle weakness, including some people that they are losing, what do you call? 食肉症 that means the flesh is disappearing And doctor say it's because of the germ eating away the flesh. It's all because of digestion. Okay, I have one brand partner, a doctor, very serious, this kind of, it's like the germ is eating away the flesh, He don't eat. He don't eat. I go to his clinic, I can talk for 4-5 hours, and never take breakfast until 7 p.m. Only take a few bites and then continue to talk to the patients already. You see, you cannot heal others if you don't know how to heal yourself, It's for me, it's a irresponsibility for you to think that you can heal others without having a good body. Okay, guys, remember this, okay? So, Jinlong, have you come across PSH? Sympathetic hyperactivity case. This happened from post-surgery. It will have sudden episode of rapid heartbeat, high blood pressure, increased respiratory symptom, sweating, muscle rigidity. When above happen, it can be life-threatening and doctor will need to give a lot of medication to calm him down. Can patches help? My friend understand patches may have reaction to his body. He's only afraid the reaction from patches will cause him to have above mentioned episode. Okay, I don't think so. It will create this episode. Is because if you have a sympathetic hyperactivity, what life is trying to do, it will rebalance it to be parasympathetic. Okay, so this is why I think it's very safe to use the product. Okay, if you're really concerned, you can put the patch, still X39 and Eon. Okay, but you can start with Eon first at night and then you see how it goes and slowly add 3 hours, X39, 3 hours, 3 hours, 3 hours, and then add to 6 hours a day, then add to 12 hours a day. Okay, you can always do it this way. LifeWave confirm work. But you see, guys, this is what I'm saying. You go for surgery, it's also not getting better, right? And the worst thing is, I don't know what kind of surgery, but maybe the surgery is for, okay, maybe I ask Priscilla to share. Priscilla, can you unmute yourself, Priscilla?
Hi,
Hi,
can you
Priscilla.
hear me?
I
Hey,
can hear you.
hi.
Hi.
You can,
Yeah. Oh,
It's me.
yeah, I know. When you say
I
nah, then
can't,
I know you are same wife already.
yeah, I can't open the video.
It's okay. So may I know
Okay.
what surgery your friend has done?
Okay, what happened was, he had a stroke.
Yeah.
So they went to do a surgery on his brain. Then, because I visited her husband recently on Wednesday, and then she told me, they did a brain surgery.
Yeah.
And when he came out from the operating theater, he actually have a tube in the head to drain out the water. So the tube, according to her description, there is actually three pillars to support the tube.
Yeah.
So what happened was the tube came out of the head.
Yeah.
And the worst part was they didn't realize it until very late at night. So that's why she said it causes this, they call the PSH.
Yeah.
So she actually also got asked the doctor, the surgery, why should this happen? It should be very secure.
Yeah.
But the doctor said, I don't know. So
my
it kind of a bit of like the imagine when they wheel him out from the ICU. Because nobody realized it. She told me until very late at night. So, and then this whole thing happened. So, yeah, that was the time that I asked you what to use. And she told me her reason why she dare not use. Actually, the husband did use LifeWave before last year.
Yeah.
Also, he had some strokes happening. So I kind of spoke to him.
Yeah.
And I think because he was a bit impatient with results.
I see.
When we went to explain to him about it, we did tell him that don't be surprised if you have some reaction, like,
Right.
more pain, because he told me his left hand cannot leave out and it's painful. So that's where he thought, okay, give it a try. And when we explained to him, that time we did tell him. And then along the way, I heard from the wife that, oh, he had this issue, pain. And then I kind of asked you, and you say, oh, it's very good when people just started using, they have, such reaction, means something is healing, which I explained to him. I sent a video to him. I even showed until where he should start listening.
Yeah.
But it always like a one-way conversation with him.
Yeah.
So subsequently, I don't know why he stopped using. And then actually, I heard last year, October, he actually had stroke again. And then she was telling me, oh, doctor says, he's very lucky, very strong, he survived. But I told myself, if he's not going to take care of himself, he's going to get it. So I didn't really contact her for quite a while until recently, something just tell me, hey, just send her a message. And that's where she told me he just got a stroke 2 months ago and still in hospital lah. So
Amazing.
yeah, so I was thinking, and she was quite afraid because what happened was this episode when his heartbeat all came out is very bad. That day when I went, she told me what you saw is very mild only. So when she described to me, when she saw it, she cried and she couldn't erase the image away from her mind, the very bad. And today, actually, she told me it happens again. But today one
Okay.
was quite mild, the episode.
I see.
So,
Okay.
yeah.
So I'm going to give you this advice. So yesterday, is always a way to go. But if you're really so afraid, right, you can start with Egon first. If you still so afraid, right, don't worry. You can say, don't worry. Let's say the main is Amy. Amy, it's going to take some time for you to accept the patches because you are really in those kind of traumatic experience already. But I heard from my senior, all these symptoms of the rapid heart rate, sweating, muscle rigidity, we don't think about the medical term first. All these things is a sign that your body is in need for more energy, more calorie. You ask about her diet, make sure she eat enough white rice.
I mean, he cannot eat. He's in tube feeding.
Okay. If he cannot,
with the tube.
right. If he cannot do any solid food feeding, can only take the milk, right? Then you ask them to the doctors, is the person eating enough or not? Because they always have a volume to gauge, say that how much of milk powder, how much of milk they're drinking a day. If you say, oh yeah, he actually not drinking enough, then you can tell her that if you don't patch, this is going to get more and more worse because now he is not even absorbing and taking the nutrient already. Then you
And
can start with Eon.
He's actually not in coma, neither
Yeah.
is he conscious.
Yeah.
So the term they put him is his semi-unconscious stage.
Right. Can.
Yes.
No problem.
So start with Eon at the belly button.
Yeah, you can start with if it's very difficult to lift him up, right? Then you can start with belly button, it's fine.
And then next day, S39 also at the belly button.
Yeah.
So start with 3 hours lah.
Yeah.
I'm not sure whether she dared to try because she saw him, that symptom came up, she very scared. She understand the patches will have reaction. So she actually told me that she's scared it will trigger and then, the blood pressure high, those things, yeah.
Yeah, so then the answer is on her. Do you think that his husband is going, her husband is going to get better and better with the assisting treatment? Or at least he want to try a sticker for 3 hours? I think is really a call. And I don't think that if the doctors, after doing all the negligence things and make him like this, and yet he still want to just listen to the doctors without exploring other alternative, right?
And one very strange thing is that day when I was there was a nurse inside there. His toe started to have red patches. It's neither blood nor things. Even the nurse who is doing the, cutting and clearing, she also don't understand why there are red dots starting to appear. And apparently, I think I remember she told me she's a little bit of diabetic. If I remember
I see.
clearly.
Okay, if got red dots, right, it means that the platelets is going down already. They mean the healing factor is going down already. Yeah. So this is why don't worry. We just take a photo of the red dots. Okay, and this can be a sign when they put the pad, the red dots start to disappear, or the recurrence getting less. Then it's a good thing.
Okay.
Okay.
Yeah. In fact, she was the one yesterday when I asked, she fell down. The same lady.
She fell down.
Yeah, I asked 3 questions yesterday.
I forgot already.
Yeah. One is a blue bag one, which is Sam. He fell very badly. And then the other one was I was asking whether, how to help with the broken ribs.
Right. Understand. Okay, Ken. So thanks, Priscilla. I will go to the next
Okay.
questions. Thank you.
Thank you.
You see, this is why I say very different, right? Just now, let's say who is the first gentleman? Simpson, when he feel the reaction, he said, I want to know the root cause. And then he find out, oh, it's because my old injury last time when I played ping pong. So now I'm healing the area. I wake up at 3 a.m. I got no lung problem. Oh, but the lung cousin is intestine. So now, the past 1 week, he got no constipation anymore. And just now we have we have a gentleman wake up at 2 a.m., stroke patients, have faith. This is healing crisis. I want it to happen. I know I will continue. And 2 a.m. wake up, liver problem. And then he said, yeah, now my nail is growing faster. You see, this is the perspective difference. Some people are so fearful of exploring new possibility. The thing is, do you believe you can get better or not? If you don't believe you can get better, doctors from a stroke do a surgery and then got a side effect, tingling there, never pay attention, is a medical negligence. And you still want to follow doctors, what the doctors say, and not exploring other alternative. So if something bad really happened, whose fault? Is it your fault of not exploring, or you still want to continue to blame the doctors? Right? My friend new user started Eon for 3 days for a skin lump between her wrist and below her third finger. The lump will move up and down with vertically a level of height. Whenever she open and close her finger, is this suggestion using Eon or suitable care continues? Okay, so it's still X39 and Eon. Normally this kind of skin lump is oil lump for lipid lumps lah. Okay, don't worry, it's a circulation issue. Okay, my father, oh yeah, I just recall, my father used to have all these kind of lump, he always go for surgery last time. Now, really, he never happened to him anymore. Last time he always have a lump over here. You touch, it will move a little bit, tung tung tung. It's like jelly like this. Now never happened to him. Some youngsters commented to her, it's unnecessary to use patches. Her sharing, but I'm younger one who know LifeWave patches. Told her this is unnecessary as unsure what exactly their conversation was about and no idea if my friend had shared on her reason for using it. For such a response of anyone citing unnecessary, any suggestion how can we respond back? Have you tried the patch? Always, have you tried the patch? He said, no. Then how do you know it's not necessary? Right? So, guys, you have to know this, right? The thing is not about the people say unnecessary. The thing is, even people say unnecessary, right? Why you want to take his word so seriously? Right? Why do you want to take his word so seriously? Right? So this is never about what other people say, you see? If today, right, if you look at the patch, you listen to all the testimonials, okay? It's only the patches, nothing entered the blood, it's phototherapy with all the patents. By looking at this fact, you will use, right? But why when people say something negative, then you want to listen to them rather than listen to your own judgment? So the root cause of the problem is you don't have faith in your own judgment. The mindset, you are still too weak already. Okay, you don't believe you can get better in your own way. I believe my method to get into my own way. Last time when my TCM doctor look at me, he always say, your son is going to spend a lot of money because got a lot of blood clot over in the body. You look at his ear, it's too small. You look at the urine, it's so thick. Since young, so I take all kind of herbs. All the doctors say the same thing. Some people say got liver problem, some say digestion problem, 脾胃不好. Some people say my lung is very weak, that's why I got asthma. Some people say I have a certain communication issue, so I got the stuttering. So if I really believe all the doctors, I don't believe that I can get better myself, right? I might still be the sick boy today, but because I believe I can heal myself. This is most important, Guys, I want you to understand this. It's not about believing these stickers. It's not about believing me. It's about, do you believe you can get better? This is two stages. If you don't believe you can get better, that is not the problem of the patch. It's not that you don't believe the patch. It's you don't believe you can get better in the first place. You have to get this up. When you believe you can get better, you start to explore solution, then you will find that LifeWave is the best solution. Do you agree with me? Some people, it's not that they don't believe the patches, is when you talk to them, yeah, this one too long already lah. The doctor also say cannot lah. Some people say cannot. Some people say this one for 20 years also like this. The medication have no use. It's not that they don't believe you, although they don't believe the patches. They don't believe themselves can be better again. Do you agree with this? If yes, type 555. Maybe some of you also have this kind of experience. Is you yourself don't believe you can get better. You can't visualize you can get better. You already admit the fact already. You compromise already. So it's not about the patch. It's about yourself. Okay? But again, if someone say unnecessary, I will always say, oh, have you tried the patch before? Okay, let me patch on you. So that next time when you can tell people, I don't feel anything, at least it's more convincing. Jinlong, my brain partner just stopped using the patches after 2 months. He has surgery before and has thyroid issue and skin allergy and fatty liver. He goes for regular checkup and recently his doctor said his fatty liver is getting worse. and told him to stop using the patches. He has also gained 2 kg of weight over the last 2 months. I believe this is a part of healing process, as thyroid is related to digestive issue. Can you verify if my understanding of his weight gain is correct? How about his fatty liver is getting worse? How do we explain this? The doctor has asked him to lose weight, so he's not eating white rice anymore. He has resorted to a lot of salad and vegetables. Alamak. Okay, if he used the patch for only 2 months and he go for the medical checkup, number one, he shouldn't go for the medical checkup so early. It's too early to do for medical checkup already, because during the healings, right, it's always up and down. So this is why, especially some people say, after I use my CRP, I immediately want to do a medical checkup. I always say no. Same thing. When you are in the middle of using the patch, before even 3 months mark, or even you're 60 years old, before the 6 months mark, don't do any medical checkup, because you are going to get haywire. Then you say, then how? Then you say, if next week is your medical checkup, you finish the medical checkup first. Then you start the patches. So in the middle of healing, especially people got all kind of liver problem lah, thyroid problem lah, hormonal problems lah, all these kind of internal organ dysfunction, right? During the up and down, right, the blood report is not going to be good. Okay, so this is why I would say, let him know that, oh, now it's only 2 months. It's a fluctuation phase. It's too difficult right now to say that is it good or bad. But the most important thing is, did he take a photo? If he has taken a photo and if he eat white rice, right, he will see that his skin is going to get better. Okay, maybe I ask him to unmute. Sim, can you unmute yourself, Sim? Hey, Sim, can you unmute yourself?
Yeah, I've unmuted myself, Jinlong.
Okay, Sim.
Yeah,
So
I'll put on my video as well. Yeah, so I do tell my brand partners, first 3 months don't do any medical checkups.
yeah,
Fortunately, they have had their regular checkups for the longest time, so they say they
I
couldn't
see.
stop going.
I
I
see.
did warn him that the results will be, like chaotic, it's
Yes.
not going to give you very accurate results, because there's a lot of detox, a lot of things are going to be dumped into your bloodstream and all that.
Yeah.
But then this doctor said, hey, you have fatty liver. If you continue using these patches and your liver doesn't get better, you're going to die. It's like, okay.
My goodness.
So he got scared. He said he had to listen to his doctor,
I
because he had
see.
seen this doctor for a long, long time, but yet he's not getting well, right? I'm like, how
My
do you
goodness.
listen with people like that? So I couldn't, I mean, I'm not here, we are not here to force people to use it, but
Yeah.
we can explain, what's
Yeah.
happening. But at the end of the day, most of them unfortunately listen to the doctors.
Right. And
Right,
did you take a photo of him before?
No, I did ask him to take a photo, but he doesn't even want to refer to the photos, because he says, my doctor said this, I have to stop using. That's it.
I see.
Yeah,
Okay.
he didn't want to. I asked him about nails and all those things. He didn't even want to answer those questions. He said, this is what a doctor said. That's it.
Okay, congratulations. We wish him all the best, and hopefully by the next time when they come back again, like all the cases, hopefully when he come back again, he is not in such a bad shape. You have done your job already. I think that's fine. If someone
Yeah.
really block everything out, but I just explained to you, you did the right thing that the first 3 months cannot go for medical checkup, especially anything to do with thyroid. And how they check the fatty liver, right? It's not really okay, maybe this one I keep it to the later. All kind of thyroid problem is definitely because of the digestion issue. If he continue to take salad and vegetables, right, there will be one day he's going to do surgery. So what I can say is this. Say, Amy, if you continue to eat salad and vegetables, we have seen so many cases that one day your thyroid will be even big troubles. But don't worry, I'm not going to push you anymore. If one day the doctor asks you to drink radioactive iodine or asks you to remove the thyroid, then you must come to me. Just leave this message, it's fine.
I have something else I want to share with everybody, which is very sad. This is
Yeah.
not somebody who is on patches, but
Yeah.
actually my daughter's ex-classmate, 38 years old,
Yeah.
for ACL surgery, and died.
ACL for the
ACL,
knee?
yeah.
I see.
And died of a blood clot.
Phew.
38 years old, yeah. So I just want to share with we talk about surgery, very risky when you're old, but young people these days, 38 years old, can you imagine? Supposed to be simple surgery, right? ACL, supposedly.
Yeah.
That it went in and never came out.
This
All right,
is
that's
what a
what I
waste.
want to share.
Okay, thank you, Sim. Thanks for sharing.
You're
Okay,
most welcome.
thank you.
Okay, bye.
You see, 38 years old, how many more time? The problem is not about the age anymore. The problem is about the skill set of the doctors right now is really different already. Jialat. Okay, wait, let me see. Oh, so got so many questions. Wait. Hey, just now got someone say your friend is coming. Okay, but let me answer all this yet. Okay, because before you there are still many. Okay, wait. Wow, so many. Wait. Okay, Jinlong, I don't have the brochure and wish to have copy. Please, where can I get it? Christina, you're sending the 6x6, right? You can get from Komala if you're in Singapore. Go to Woodlands office. Okay, and you can get from any of your upline, any of your SPD. You see the word. Anyone here there, you ask to LifeWave who is the SPD, then they will know where to get already. Tulasi, Tulasi, hi. Jinlong, I'm back after 7 months as promised after patching S39 Eon Daily, which ended 15 July. Was introduced by my upline to start on S39 around October 2023. I was using it and it was not serious because I have no knowledge about LifeWave patches. After some arguments and serious talk was introduced, your Zoom session. After listening to you, I started looking for more information on the internet, YouTube, and some Facebook. I was hungry for knowledge for this product. Fantastic. Now I'm on the right track with help from Pochu and from you. As for now, on CRP 15 days, which will be ending in 3 days' time, my question is I have a lot of pain in my left leg from hip joint, knee joint to heel. Went for x-ray and ultrasound, nothing much serious. Guys, you see, whenever you have this kind of symptoms, right, don't spend money first. You donate to me lah. You come to Zoom, I give you my bank account. I charge you 10% for the doctors. Like just now, the TCM for Simpson, right? 10 seconds, I reduce 50% already. You don't even need to do cupping, I charge you 10% also okay. No problem. 5% also okay. Went for x-ray and ultrasound, nothing much happened. That was the answer I got from this doctor. It was so frustrating. They had to go through so much pain and left foot is swollen. Okay, don't worry. Tulasi, come, let me help you. Tulasi, can you unmute yourself?
Hi,
Hello.
Jinlong.
Hello, come back.
I have written more there, continuing.
Sure, amazing. Thanks for staying on, because now if you have a lot of pain from your left leg to your hip joint, right, all those area, for here this area, right, I'm very confident, 95% confidence. You had a fall, hit there before. Do you remember, or even not so accident, it's about really a fall down and then you sit on the floor or something at the left side?
Okay.
Did you have this kind of fall before? You fall down?
Yeah, I fall down many times on the
I
ice,
see.
I
So
broke my radius also with what is it called? T plate with 10 screws.
I see. Okay, so this is a good thing, because if you starting to fix the old injury, right, I believe you might have seen quite a number of changes beyond the pain, right? Did anyone say you look better?
Jinlong, I don't know. I'm not so sure about it, but I see some changes in me.
Tell
I
me.
have 2 toes, which is blue-black. It has
Yeah.
turned to a normal color, That means I know the blood circulation is good for my feet,
Okay,
And then
okay.
and then all of a sudden my BP went up 190 to 120.
Right.
I don't have this BP problem at all. And early morning, 3 o'clock, I got up with a bad headache and I checked my BP. It was like that. And then I was admitted to the hospital.
Right.
And then, I came back after 1 day and they want me to take some medicine. And I hate medicine. I didn't take any medicine.
Right.
Then it come back to normal.
Right. Okay,
So
if there is one time that your blood pressure really goes up and you wake up about 3 a.m., well, how come today everyone wake up 3 a.m. one? You guys doing a party? So many people wake up 3 a.m. Okay, so don't worry. Anyway, the thing is passed already. If next time you find that your blood pressure go too high, right? Do you have LifeWave with you?
Yes, I have LifeWave with
Okay,
me.
remember this, you write it down now. Whenever you see the blood pressure, because if you have so much of surgery before, right, when the body want to move the blood healing factor to all around the body, there will be time that the blood pressure goes up. You can feel your vein, or okay, you can feel your pulses at the side of both, at both side of your neck, right? Okay, you put LifeWave, right, 10 left. You put LifeWave, right, 10 left.
Okay.
So you will see, and drink some water, you will see the blood pressure goes to normal pretty quickly.
Okay.
Okay, so other than that, it's perfectly fine, because if your pain is really at the area, you always have a fall there before. So it is normal.
Okay.
Okay, so
Okay.
please, I really hope you can have the patience to really go through this. But if you really see that the bruises is getting disappear already, right? Do you find that your hair
Yeah.
growing more, less hair loss, the nail growing faster, growing harder?
For me, I didn't have any complaints about it, but my hair drops a lot.
Yeah.
That doesn't bother me much. The thing is that I have in polyneuropathy,
Yeah.
which the neurologist, he told me that I might end up in wheelchair. That is very frightening, and that is what I seek help for.
I see. And then now you start to see the bruises disappearing already. It means that, I
Yeah.
believe, do you find that you got more strength right now? You got more strength? Like you can walk up the staircase more, you can walk further without having a rest?
Jin Long, about this walking, I used to go 12 kilometers per day, you
Yeah.
know.
Yeah.
And then I started, and then that was around last year, somewhere around that. And then because of all these problems, and I have other things also, so I didn't go for walking. And then I put on a lot of weight. October 23, I started this LifeWave. I was 62. Now I'm 74 kg. The problem with my left leg is so painful. Sometimes I feel like dragging, as though I'm dragging my left leg.
I see.
That is the main problem I'm having.
I just say. So you are saying that the area that you're feeling a lot of pain right now is the pain that you used to have already. It just that now it get even more painful. Can I say like this?
Yeah, it's more painful.
Okay,
It is the femur head, you know.
I see.
The hips, femur head, the kneecap, and then the calcaneus heel.
I see.
All the three parts. Then you can imagine how I managed to go, you know.
Right.
So I hardly go, say maybe I try my very best for 6,000 to 7,000 steps. I try myself very best to do
Okay,
this.
understand. Tulasi, if you are really in pain, right, when the body is healing, you don't push yourself to walk. You don't push yourself to walk. You don't push yourself to use the joint. Because when you have pain, right, when you walk, you will definitely compromise your position. It's going to affect your spine overall. So you can do some, you know, but those are Chinese kung fu, you know. Okay, but now you don't walk so much first. They mean walking at this condition, right? It can cause more harm. So what you can do right now, right, is to swing your hands. So you stand there, just keep swinging your hands to improve the blood circulation. It is very good already. Yeah, I don't want you to increase the wear and tear of your joint right now, especially now it's really healing time.
Okay.
Okay,
So you
take it.
think that pain is a healing crisis, is it?
Yes, because
But I already have more than 1.5 months, you know, I'm suffering, and I don't take any tablets, but this time I couldn't take the pain. So I'm taking naproxen plus Panadol.
No problem. So you can take the painkiller for you to address the pain, because it's fine, because the painkiller at the end is going to get rid from the body also with the patches. So now it's really healing the area. We just give it some time. Because if you really have a big fall before, the patches definitely want to do something about this.
Okay.
Yeah?
Okay.
Okay?
Okay.
Okay, Dulasi.
should I continue? Now I'm doing this CPR. No, CRP, the protocol will be finishing in 3 days' time. Should I stop and then continue with Aeon and X39?
Okay, your CRP for 30 days or 50 days?
I beg your pardon?
The CRP you done for 15 days or 30 days already?
15 days.
50. Okay, I need you to do one more round. Is it okay? You do a total of 30 days.
Okay. Okay. I'll
Yeah,
do
the
that.
reason is because if you start to feel the healing start to kick in already, get even more painful, it means now it's really starting the next round of healing already. So then might as well we continue the next cycle.
Okay.
Okay, thank you. All the best.
Okay.
Thank you.
Thank you so much, Jinlong.
Welcome.
We all
Bye-bye.
meet you. Okay,
Sure.
bye.
Thank you. So you guys, you see, this is something that you had to be aware about our body. So he used to have bruises around, right? After putting the bed, all the bruises disappearing already. It means the circulation get better already. And then when the circulation get better, the body will try to heal the body, especially the area where you have a lot of injury. For her cases, she complained about her left hip very painful. Then I asked, here area sure got fall down before. Yeah, I fall down very seriously this side. Strange, right? So your body is not so difficult to be understood. We just need to have the awareness. Recently, I woke up 3 to 4 a.m. Wow, again, 4 people wake up 3 a.m. today. You guys brothers. Normally, after 4-5 hours sleep for these 2 weeks, about 2-3 times per week, just wondering why. Okay, it's healing of lung. Christine is healing of lung. Okay, so since you only asked me this, why I will say healing of lung. If you want to know more, you come next time, okay? Because I running out of time already. If you wake up at 2 a.m. but not all the time, wake up at 2 a.m. No, it is fine, okay? If you have the idea that I always wake up at this time, it means that it is quite serious enough already. Because once in a while you wake up at 2 a.m., you won't remember. Am I right or not? So large intestine, you are right. How to put the pad on left eye glaucoma? X39 and Eon is always the most important. And any other pad you can consult your outline. Okay, you can put a carnosine nearby the area. Boon, hi Jinlong, regarding the LifeWave supplement, the potassium, creatinine, monohydrate, etc. are too high for dialysis patient. Can help to check how to overcome. Okay, first of all, we never do any clinical study on the dialysis patients. No supplement is going to carry out the study on dialysis patients. So it's really your choice. But if you ask me, I will say this way. You are dialysis anyway already, right? What worse can it be? Whatever nutrient that you are going to take in is going to be washed away by the machine, right? Then what is the biggest worst outcome that it can turn out? But what is the upside? What if when you take the body just needs the potassium and creatine amino acid that to build up your heart, to build your nitric oxide, to build up your NAD, to build your blood vessels, to build your muscles, strengthen your heart function, the nitric oxide, to further activate your stem cell because of the sibacton. Why don't we look at the other way? Since you will not get worse already, right? You already dialysis already. The kidney is not functioning anymore. You are relying on the machine. So why we need to worry, right? MH, if new user patch X39 Eon got constipation, how come instead of helping with digestion? If someone put the patch got constipation, MH, can you unmute yourself, MH? MH, can you unmute yourself?
Hi, Jinlong.
Hi, are you the one who got the constipation?
No, not me. User's mother.
I see. If someone put the pad then got constipation, it means that last time the bowel movement is very watery. Yeah. So
Okay, the initial reaction when she only started about using less than a month.
I see.
Initially said got diarrhea. Then
Yeah.
the mother feel very weak because I think too much drain because of diarrhea and all. Then
Yeah.
after the diarrhea gets okay already,
Yeah.
she still felt weak.
Yeah.
Then recently said after fetching, then now become constipation instead. So
Yeah,
very
yeah.
surprised. Normally this would help in the digestive system, but I don't know why.
You are right. Yeah, right. So okay, can I recap? That means that before the patch, right? Your friend's mother got a diarrhea, then it started the patch, right?
No. When you start patching, it at first got diarrhea. Then after the
see.
thing stopped, we okay already. But the person was very weak. The mother was very weak.
I see. Okay,
Then
okay.
now it's not diarrhea anymore. Now he starts to have constipation. This is like
I
it's changing
see.
from diarrhea to constipation.
Okay, okay,
Mm.
okay. That means the first healing crisis after the patch, then he got diarrhea. Okay, if
Yes.
if someone put the patch then got diarrhea, right? They mean last time he got constipation. It's always the other way around. So you ask whether before the patch she got any constipation or not. If she
Right.
say
Okay.
I don't have. Okay, if don't have constipation, do you rely a lot of fiber, probiotic or laxative to help you with your bowel? Most of the time, or take a lot of fruits. Most of the time, yes. That means that the body is already constipative already. It's just that you are taking all these
Right.
kind of supplement to pull. So all these kind of supplement and ingredients, right, is only force things to come up, but there are still a lot of residuals too, lining around the intestine. So when you put the
Right.
patch, right, the body want to wash out all these residuals, so they got diarrhea.
Okay.
Yeah. So after you go all the diarrhea already, right? Okay. So now the body, the large intestine can start to rework again. The intestine will start to absorb more water for nutrients, and then you will start to have constipation.
Okay.
Yeah. So how do we give them confidence to know that we are saying the right thing? You look at the skin complexion and those pigmentation. After going through those diarrhea, did they find that her mother look better, look fairer? Because those residuals too in the body, when you keep on sucking, right, the body will not be fair. So after clear the diarrhea already, right, the skin get fairer. So you ask whether they see. If they say, oh yeah, I really realized my mom getting fairer, then
Okay.
it's confirmed what we say is right.
All right. Okay.
Okay, thank you, MH. Thank you.
Thanks, bye.
And MH, after you got the answer from there, can you come back and share with us their reply so that we can learn from each other?
Sure. Of course.
Okay, thank
Okay.
you. Take
Alright.
care. Take care.
Thanks. Thank you. Bye-bye.
Okay, bye bye. Amazing, right? I'm so sure. Jinlong, my wife has been using S39 Eon for 2 months, patching at GV40 and CV6. However, these two areas are very itchy now and red spot started. Can you advise what other areas you can patch to solve itchy issue? Up and down a little bit. So you don't need to put exactly at the location. You can put down a little bit, a little bit. Okay, so avoid the exact location. My colleague is online. Karma, Allah. Sorry, Arina, your Karma offline already lah. Let him wait too long already, is it? No, Karma is still here. Kamal, can you unmute yourself, Arina friends? Kamal. Thank you for staying until now. I know we are too late already. Kamal?
Yeah. Can you hear me now?
I can hear you, Kamal. Thank you for waiting for 1 hour.
Yeah. It's okay. Thank you so much. Actually,
okay,
this
come.
actually this question is for my brother who is having a CKD issue for
CKD?
past 2 years.
Yeah.
So he was under ICU for 1 month initial stage when we identify he's having a CKD. That time the doctor told him like he's lost almost 60% of the kidney function is lost.
Right.
So after that, they keep on medicating him, and he's having a diabetic and also having a BP. So that makes him causing this CKD issue. Then after that, we were trying to giving him medicine to control the diabetic and BP, but still sometimes it's getting worsen day by day. But in past 2 years, when we take the results, no, there is no improvement on the creatinine. The creatinine was keep on increasing from 2.7 to now it's 6.7, and then the EGFR is almost fall down less than 15. So still the doctor is advising him for dialysis, but still they are not insisting him still because he's stable now. Stable in the sense he's having no fluid buildup in the leg, and also he's urinating urine normal. There is no issue in that, but still the doctor is wondering why they are not insisting him to do dialysis immediately. The thing is, we are also doing the parallel alternative medicines in South India, the Siddha medicines, herbal medicines. So we are also parallelly doing the herbal medicines, maybe, and also we are doing the acupuncture also. We are trying parallelly, not only we are believing in allopathy, So we are trying all other medicines also. Now I just through my colleague Arina, we came to know that this patch will helps a lot. So I just want to understand by using these patches, will it trigger the existing issue worsen? As you said, now I was listening to you for past 1 hour, so I just come across like it will go up and down. So since his condition is almost the borderline, anytime doctor can advise him go for dialysis immediately. So can I use the patch now, which can save him from doing dialysis, and how helps him like maybe over the period of time, like how we can know is it really working for him like that.
Okay, so I'm going to show you a video, okay? So this lady, after doing the colon cancer treatments, right, he got acute kidney failure also, and the
Okay.
creatinine go to 461. Okay, so I'm going
Oh.
to play the video, so you see now he's complete recovered already.
这是我家婆，今年86岁，不
Okay,
幸
so
得了大
you see
肠
last
癌
times, right?
的电疗安排。
Yeah.
Yeah, and now
在
she's
12月27
completely
号，
okay
因发
already. You
烧、
can even
血
start
压
to walk
低
again, go to Genting already. So now for all kind of CKD patients, right? Okay, number one, the most important things is make sure the hydration is enough. We have seen a lot of people who got CKD, if he can still urine, but the EGFR is low, right? If you look
Yeah.
at the calculation mathematical formula of doing the EGFR, it has a lot to do with the concentration. So if your water intake is not enough, the protein is high, the protein not so high, but the water intake too little, it can become more thick. Then the EGFR will go down. So make sure number one, the water intake must be enough. So now we talk about the patch.
Yeah.
So far, we really have good story when it comes to the CKD. So those people who are already on the kidney dialysis, right, already on kidney dialysis, almost 100% of the times, right, for someone who are very sleepy and fatigued, they can start to gain back their energy. They can start to gain back their vitality. So for those people who are at the brink of going for dialysis, right now, the longest one that we have seen is about 4 years, haven't gone for dialysis. And one particular cases in Singapore, the doctor said next month we have to start dialysis. But he started to put the patch, 6 months. The doctor said this year 2025 January need to go for dialysis. So we get him on the patches, and when he go and see the doctor said come to see me 6 months later because now it seems stable. So we have a lot of confidence about this, but again, it depends on the lifestyle that he is having right now. My suggestion is when you put the patch, right, you can do all kind of homeopathy, but try to reduce the intake of medication or supplements. I know because some homeopathy, they might give you 20, 30 pills of supplements, which I think is not so good, especially for CKD patients. So the first sign of changes that your brother is going to see is for kidney patients, for 5 to 7 p.m. this period, he will feel very tired. If he start to feel very tired, it means that this is a very good sign. The body is healing the kidney already.
Okay.
Yeah.
And also, you said you take enough water. Recently, we took a scan. Actually, we take a ultrasound scan to see the size of the kidney. The thing is, the kidney size is slightly bigger than the normal. That's the
Right.
report says. So I don't know whether it is a good or bad because he was advised to consume very less water. Then I
Yeah.
thought after 2 years, if we take the scan, the kidney size must be shrinkage. But his kidney size is bigger. I am wonder how it will be because normally when you take water consumption less, normally your kidney size will reduce. But in his case, the kidney size is bigger. Then again, doctor telling that since the kidney size is getting bigger, you reduce your water consumption.
Amazing. Okay,
So
I think yeah, yeah, right. Okay, you asked a very right questions. Okay, let me repeat your questions. So you're asking that the doctor said the kidney is getting bigger, so we have to reduce the water consumption. But after reduce the water consumption, the kidney is still getting bigger. You are saying like this, right?
Yes.
Okay. So actually, right, when we have dehydrated, more blood is going to go to the kidney that cause the swollenness. Of course, in some circumstances,
Okay.
especially when you got heart problems, right, you got water retention. Then the doctor asks you to drink more water. But the thing is, the key is not about the drinking that water. Is the own circulation is not able to move away the water. So a lot of time people got lung problem, the heart problem. The doctor say don't drink so much water. You got water retention, but the water retention get even more serious. So this is what is happened for your brother right now. I think the hydration is not enough. So you reduce the water, the amino acid is going thicker because you got less water, but the protein is still inside, right? So get thicker, so the EGFR will goes down. Then this become a vicious cycle. So my suggestion is drink 1 liter. You can start to drink 1 liter water first, and then you see how your brother feel. And then slowly you can increase to 1.2. I think maximum go to 1.5 should be good enough. But if you want to drink the water, make sure it's not extreme alkaline water, not RO water, not purified water. You can just temporarily drink some mineral water, like a spritzer water is cheap option, Evian water is okay. I know when you tell the doctor drink mineral water, the doctor will jump again. Why? How can you take mineral water? Mineral is not good for your body. But I've seen a lot of cases when you can give your body enough nutrients, right? It's not just about the kidney, you see. It's about your lung function. Your lung need to pump blood to heal the kidney. If you don't give any electrolyte to the heart, right? How can the heart to pump blood? If you don't have enough water, how can the blood flow to send the stem cell to the kidney? So if you don't drink water, we continue to reduce the water intake. We are basically vanish the hope for the kidney to function normal again. Can you follow me, Kamal? Are you here? Oh my God.
Okay, understood.
Understood?
Yeah,
Okay.
yeah, understood.
Okay,
And also,
okay.
I have one more question. Actually,
Yeah.
I'm planning to use this patch for my mother who is having arthritis issue.
Sure.
And also, I just since it's a self-healing technology, so the thing is, we have done surgery for my mother for hernia.
Yeah.
So we did a surgery. So while using this patch, will anything happen to the mesh inside?
Okay, don't worry. It will get even better. We have patients, customers that they didn't go for the surgery. They only use the compression pens to push the intestine back, right? Okay, your hernia is at the lower abdominal or?
It's an umbilical hernia. It's
Okay, that's okay. So after putting the patch, right, they don't need to wear those kind of compression pants already. And
okay.
really the muscles start to close back, because the most important thing is not about the surgery, because even you can use the surgery to put it back, right? The underlying tissue, you still need stem cell to build back the muscle, right? But a
Okay.
lot of times, right, even you do the surgery, with time, it will still broken again because the muscle is not building back, because I believe your mother maybe 70, 80 over years old, the stem cell is not enough. So the patch, it will help you to strengthen it back so that it will not have recurrence. And the most important thing is, beyond this hernia, you are going to see your mother can walk better, can cook better, can have fun with you better. My mother has a knee pain, couldn't even walk up the staircase. Now he can go to Jeju Island to walk 20,000 steps. I'm going to show you a video. Is it okay? You are the first time coming to the Zoom, right? Hello? Are you the first time coming to the Zoom?
Yeah, yes.
Okay. Let me show you my mother, okay?
Yeah.
Okay. So
Yes. Yeah, yes.
okay. Let me show you. Okay, this is me before and after. Look a little bit better lah. Huh? So this is my mother. Okay. Okay. So previously, she has difficulty walking. So she always sit down because of the knee pain.
Okay.
2 years later. Easy, yeah?
Oh, great.
Great. And I show you my father. I will show my father. Okay, wait, let me see. Okay, because you are you reside? Do you reside in India or in Singapore?
No, I am in Singapore. My parents and my brother are in India.
I see. Okay, you see my father. My father hair is black. My father didn't dye his hair for almost 2 years already, and all his siblings, his friends are all white hair. He's black hair. 72 years old. You look at my
Oh,
grandmom, 96 years old, from complete white hair to gray hair and black hair.
okay.
Amazing, right? So this patch is overall healing. If you are already on Ayurvedic homeopathy path, right, this is beyond homeopathy already, because homeopathy, they are still using natural remedy that is molecule based. It means that there's nutrients, there is acupuncture, but
Yeah.
LifeWave is using signal based. Nothing entered the blood, but it remind your body how to heal like the younger days.
Okay.
Okay, thank you so much. Take
Okay.
care, Kama.
Thank you. Thank you. Thank you so much.
Thank you. Bye bye. Guys, this is why you cannot bulat. Bulat means you cannot take doctor words, right? You see, doctor say need to go for surgery. After go the surgery, then got the sympathetic hyperactivity already. So now, go for doctor check out. The doctor say don't drink so much of water because the kidney is big. So now don't drink the water, the kidney get bigger. Strange, right? Because the doctor have no understanding. The doctor only memorize. He think that if got water, if got anything that's bigger, it means water because swollen, right? Not necessary. When you fall down, your leg get swollen. You think it's only water? The reason the water is there is because they want to send more blood there, so they feel warm. So when the area says kidney, they don't have enough water. It don't get the nourishment. It don't get the moisturization. It get cracked. It get broken down. So the body need to send more blood to the kidney, right? It's also cause a swollen. So a lot of times, right, the doctor advice is creating one more problems. It's just the heart problem. I always hear doctors say, your heart got problem, don't drink too much of water. This is why you got the water retention. So the more you don't drink the water, the more heart cannot function because your blood becomes so thick, no water. How can the heart pump? So just because you have a first problems already, you would rather to create the second problem so that you ignore the first problem rather than why don't we keep it only one problems. You get the idea? Yeah, now got leg swollen, but at least if I continue to drink adequate amount of water, at least my heart still function. Yeah, I can live with the water retention, the water accumulation. It's okay. At least we keep the one problem. But because of this one problem, you try to solve it, you don't drink water, and then your heart getting more and more difficult to pump. Your heart cannot pump the blood to your kidney, cannot pump the blood to your liver, cannot pump the blood to the intestine, cannot pump the blood to your stomach. You cannot digest food anymore. You don't have appetite anymore. Not knowing that it's because you are dehydrated. You get dizzy, you get vertigo. People say it's the doctor problem, it's a heart problem. No, it's because of dehydration. So the doctors, okay, I give one problem, one ideas. Okay, sometimes you cannot solve problem right away. It takes time. So its factor is the time. Result, safety, and time. Which one would you choose? Number one, your heart got water already. Okay. So you say, okay, it's okay. Let my heart go water. It takes some time to expel out. I still continue to drink water normally, not over drinking. I will control my water intake because I know I need water for the rest of my thousands of other body function. So then you continue to drink control amount of water. That means not as doctor saying lah, you drink as a normal level. So at least you keep the problem to one problem, right? But if you listen to one doctor, doctor say don't drink this, don't eat that. For one problem, go to two to three, three to four, four to five. This is the problem of the doctors today right now. Patching for 70 years, they are using their common sense. They are not using their understanding in body mechanism. They think that soreness means water. Patching for 70 days for X38, you but sleeping in the afternoon. Is it normal? I can afford to nap as I'm working. Oh la la, Zoom user. Lie, Zoom user. Okay, Karma, I hope you are still here, Karma. Okay, this is exactly what you are going to see. You see, it's always so lucky one. When someone asks one question, the next person will ask the similar thing to prove the point. Okay, Zoom user who talk about you feel sleepy in the afternoon, can you unmute yourself? Zoom user. Wow,
Hi, Jinlong, I'm Margaret here.
Hi, Margaret. How long have you been using the patch? 70 days.
Yep.
Okay, if you put the patch and then you feel sleepy in the afternoon, is it like after 4 p.m., after 5 p.m.?
Yes, around that time.
Okay, this time is where your kidney is healing.
Kidney is what? Sorry?
Kidney is healing. It's healing the kidney time.
Okay.
Do you have any kidney problems?
No.
No, okay, don't worry. Do you find that your hair getting darker?
Cannot tell.
Cannot tell. Do you find you have less hair loss?
I don't have this issue.
This very good. Baby hair, do you realize anything?
Maybe did not notice.
It's fine. Do you find that your body feel warmer?
Yes.
Okay.
Yes.
Good thing already. It means the kidney energy is strong enough, so now it can start to move the chi around already. This is always one of the most important. Do you find that you are more except the evening time? Do you find that now when you work right, you are more alert? You are more easily concentrate. You got better ideas. You can think things better.
The early morning, yes.
You know why? Because kidney control the brain. Now is healing the kidney time. That means that your kidney used to be not so good. Not so good means you might easily get lower back sore. You couldn't really focus. Your body feel a bit cold because the chi is not moving. When you put the patch, when it start to heal the kidney, right? These are the changes that you see, but you will definitely feel sleepy 5 to 7. If you are able to just have 1 to 2 days, really take a nap during their times, right? The body get enough rest, it will not happen again. But if you keep on drag, right? Then you will keep on feeling sleepiness. So I would suggest you have find one day, say, boss, I need to go back. I got a healing to do. So go back and sleep, take a nap. 1 to 2 days time. When you can always come back to work after you take a nap or whatsoever, it will do much better for you.
Okay.
Yeah.
Can.
So for the past 70 days, right, what are the biggest changes that you have seen? Do you find that your skin complexion also getting better?
Yes.
Okay. Do you find your digestion get better? You can eat more?
Yes. Very hungry easily.
Very hungry, right? Yes. See, all kind of healing, right? Before it heal the kidney, it always heal gut digestion and the heart first.
Okay.
Yeah, so it's always, this is what is in tandem. If now you think back, right, when you put the pad, you realize, yeah, my digestion get better first. I get more hungry first. I want to eat more first. Then now it start to heal my other symptoms already. Now I start to feel tired. Did you start to see there is a things that is being changed every 1 to 2 weeks time?
Yep.
Yeah. Congratulations. This is how this is the operating system in the human body.
Okay.
Okay, all the best. Thank
Thank
you so much.
you.
Thank you.
Thank
Bye-bye.
you. Yeah, bye-bye.
Kamal, I hope you are still here. Kamal, this is what I mean, right? If you
Yeah,
somehow
yes, yeah, I'm still here. Yeah, I'm just listening. I'm planning to hear the full session so I get more explore more.
fantastic, Kamal.
Yeah.
Yeah, so just now what I said about you, if someone fall asleep at 5 to 7 p.m. very sleepy, right? It means that the kidney is not good. So for your brother case, when you put the pad, you will feel this kind of symptom. But before the body heal the kidney, like the lady said, oh yeah, my digestion get better, my body feel warmer. I want to eat more. You always have all these kind of symptom, all this kind of improvement leading to the healing of kidney. Just be sure, rest assured, this is how our body heals.
Also, since he's having the diabetic, when we feel hungry, is it advisable to eat like a little big snacks, something like that?
Okay.
Should not spike the glucose, right?
Okay. So after you join as a brain partners already, you can ask Irina.
Yeah.
To
Okay.
to join our builder hub. In this builder hub, right, there is one case that you will be very surprised in these cases. So someone called Priscilla Sim also got diabetes. He get better, and also this is a dialysis patient. For the last 5 months, lost 18 kg from 103 to 85. Blood pressure improved, and now from a very stiff leg to like tofu leg, more energetic, and he has a type 2 diabetes.
Okay.
Can you see the difference right now? The whole body becomes so much healthier. She looks so much better.
Yeah.
And you know
Yes.
what?
Yes.
Yeah. And the magic pills is really eating the white rice. Okay. So
Listen the story.
yeah, so you see the story, and the most important thing now, even he's diabetes, remember many things we need to take care. We need to consume proper diet. Okay, I always suggest white rice. It just the white rice in the beginning, you don't take too much. just always in moderation. You can take slightly less than other people. You can take more veggie, chicken, but the white rice is important. You need the calorie to build the energy.
Okay. Okay.
Okay, yeah. Take care so much. Thank you.
Thank you.
Okay,
Thank you,
welcome.
Dave.
Amazing. Lydia, how can I use the patch to reverse diabetes, put on weight, and control cholesterol? I've been using the patch for 5 months. Can I? I mean, of course, Lydia. Lydia. Okay, Lydia.
Yes.
Okay, hi.
Yeah.
So, you got diabetes, you got put on weight, control cholesterol. For the past 5 months, right, what are the biggest changes that you have seen?
I think I sleep better. In some ways I sleep better, and then I feel warmer. I
Feel
perspire more
warmer?
easily now. Yes.
Okay. Don't worry.
Yes.
So now the reason you still putting on weight, right, is because of the water retention. So, your digestion is still not so good. If
I'm
you
not
now,
putting on. I want
sorry?
to put on weight.
Oh,
I'm
you
not
want to
putting
put
on
on
weight.
weight.
I want
Okay.
to put on weight.
I see.
I'm underweight.
I see. Okay. Then it's even easier to understand already. So now you start to feel you can sweat better compared to last time, right?
Yeah.
Okay. Your body feel warmer, right? Do you find
Yes.
that your digestion is getting better? Like you feel hungry now. You want to eat more right now. You get hungry more easily.
Yes.
Yes,
Yeah.
right? Do you eat white
Yes.
rice?
My appetite is good. Yeah.
Good, okay. Do you eat white
Yes,
rice?
I already started eating already.
Started eating how many
Yes.
months ago?
Last time,
Huh?
I take about, how should I put it? Maybe 1/3 or half a bowl each for lunch and dinner. I try to cut down because I think if I take rice during my dinner, right, the next morning when I wake up and take my blood sugar reading, it's a bit on the higher side, I think.
Okay, even the reading is on the higher side, right? Do you feel any dizziness?
No.
Then it's okay. Don't need. Okay, I tell you what. All the blood sugar, the reading, right, from the past 20, 30 years, it has we keep on pushing down. So I think is really a lot of lie between the reading. So if you feel okay, don't worry. Why we want to dictate our life by a instrument that we don't even know how what is the calculation basis? It's perfectly fine. If you are taking only like 1/3 of bowl, they mean one day only have about half a bowl of rice a day. It's a little bit too little. Okay, but don't worry, I can work with that. So for when do you start to eat white rice? Is it last 1 month or for the past 5 months?
The past 5 months, yeah.
Okay, taking months. Okay.
Yes.
I see.
And I take the Sanjivini cereal also in the morning. Every morning I take 2 tablespoons. Yeah.
Good enough. Okay, then your breakfast, have lunch, have dinner should be fine. So now you start to sweat already, right? It means the digestion is getting better already. Okay. And apart from the sweating, your body feel warmer. Any other sign of change like your sleep, your energy level, your bowel movement, your hair growth, your nail, any other improvements?
The rest are still quite stable like before.
Yeah.
Yeah, the rest are still quite stable like before.
Okay.
Yeah.
Do you have any low blood pressure or anemic?
No.
Okay. Do you have
No.
any multiple surgery?
No.
Okay, then should be fine. So Lydia, whatever you are doing right now is good already. How old you are?
65.
65, need about 7 months. Now if 5 months already, right? I think that there are some other changes because 5 months apart from the digestion getting better, you should be other changes unless you are really not eating enough. Maybe like for example, maybe I will eat one third of the rice in lunch. Maybe sometimes I cut down the rice in dinner, but sometimes I eat noodles, sometimes I eat bihun. Right? That means overall the rice intake, although you start taking rice, but the volume is still not enough. I want you to increase the volume a little bit. Because if you have no enemy, you don't have multiple surgery, right? The body can heal. Now you can start to sweat already. You start to feel hungry already. Do you have snacking habits right now? They mean like now sometimes you easily hungry, then you want to take some snack.
Sometimes, yeah.
Sometimes,
but I take
okay.
nuts.
Yeah, this means that you are not eating enough already. If you are eating a proper meal, that means you proper eat already, have enough calorie, you will not have craving for snacking. I don't snack at all. So if you have snacking habit, it means that the main meal is not enough. The calorie intake is not enough. You just don't care. Don't worry. You now already cannot put on weight already, right? Why you still want to cut down? Go on it. One full bowl is fine. Just go out to eat. Just give me some times, okay? Now you're 5 months already, right? You give me another 2 months, so 7 months. I assure you, you will see a very different interpretation of health. The reason why you're worried right now, you don't need to take so much of sugar, white rice, because next year the reading is not so good. You are still living in the world of the Western doctors trying to impose on you. I want you to break away from this. Give me another 1 to 2 months time.
Do I
Okay?
need to like patch X49? Because they say that X49 helps to also
Don't need.
build muscle.
Don't need. Now, what your problem about lacking the sickness? You are lacking the calories. Yeah, okay, I don't worry, okay? I have a lot of people initially also like you. I start to eat already, but eat little lah. How come don't see result? Of course lah, you're not eating, pumping the petrol to the car. How can the car move, right? Okay? Just follow my advice first. I'm always here anyway. So anything happen, you can always complain here. But until now, you don't hear any people complain, right? So this is perfectly fine, perfectly safe.
Of course, I know that I did tell you that I'm doing weight training also. That's why.
Don't do the weight training first. Don't do the weight training first.
How about light one? Light ones, is it okay?
If you really want to do exercise, right? You do qi gong, you do ping shuai gong. This is better. You want the qi to move to the muscle to grow the muscle. If you are doing weightlifting, right? You are basically wasted the nutrients to force your body to build unnecessary muscle. Yeah, don't need. I can get where you're coming from, because your idea is about don't take so much of white rice, reduce blood sugar. I got diabetes already, and then I lose weight, so that means I need to increase my muscle mass. So I better go and take more protein. I want to go and more training, weight training, because it's the only way to build muscle by doing resistance training. All these things sounds good in logic in the Western world, but it is not correct. In Chinese medicine, this is completely the wrong way.
Then how do I exercise? Can I use the trampoline or not? Is it okay for me to do those HIIT, which is like 15 minutes exercise a day, that kind of thing?
Okay, Lydia, before you have big changes, we don't do that first. You can practice Qigong, move the Qi first, because now, okay, the thing is, the root cause is, it's like asking me, Jinlong, can I really step on the car to move faster or not? Because I want my engine to run smoother. And I say, Lydia, it's not about the car want to run move faster or do the HIIT to do the sprint. It's you are not even pumping the petrol to the car. Do you get the idea?
Yeah, I understand.
So you need to pump the petrol first. So you cannot say, the petrol pump little bit, but I want to move faster. I want to go KL faster. Then the load is not there. And then it will even weigh out your body faster.
Yeah.
Okay,
Understand.
understand.
Yeah.
Okay, thank you. Take care.
Okay, thank you. Yeah.
Guys, do you understand the metaphor? It's like your car now go petrol. You pump only 500 ml of petrol only. And now you ask me, can my car go to KL? Huh? No need KL lah. Go to Melaka, okay? Can? How to answer? It's not about whether you want to, no, it's okay, Jinlong. I can go to KL. I do like exercise. I drive slowly. Can or not? I drive slowly to KL. It's not about you drive fast or drive slow or going KL or Melaka. The thing is, you don't have a petrol. Okay, do you get the idea? If yes, that 555. Do you find this metaphor is quite funny? That 555. Okay, anyway, Lydia, I'm not here to be sarcastic. Sorry lah. I a little bit sarcastic lah. The reason is I'm sarcastic not because I want to make fun of you guys. I want to let you know that it's because our whole mindset is being so manipulated by the Western already. Right? We have fixated mindset already. I'm trying to reverse it for you. Okay? If I don't be sarcastic, if I don't use this kind of metaphor to make it, oh yeah, makes sense, that is very hard for you. The reason why I have the mindset that you guys don't have is not because I'm smarter, it's because I'm younger. You guys have been listening to the doctor for 40, 50, 65 years already, you know. I only about 10, 20 years, so I got less polluted. So it's easier for me to wash away. So don't worry, I'm not here to make fun of you. I just want to let you to know, oh, okay. Jinlong, I had nerve decompression, L4, L5 last July. I had numbness on my right foot and was corrected by the decompression operation. Lately, my right foot got numbness again. I started patching in February till now, 6 months. Does it address spine problem? Yes, it will. If you IV qua, okay, IV qua, I really want to unmute you, you know, but it's too late already, but I still want to unmute you. IV qua, can you unmute yourself?
Yes, Jinlong.
Hi, Ivy. Okay,
Hi.
so do you find that the numbness getting less?
Actually, the numbness was better. Then, just about 2 weeks ago, 3 weeks, it
To go
started to
exercise.
come back.
I see.
So
Okay.
I don't know, is it a new nerve compression or what
Okay.
happened?
Okay, don't worry. The numbness on your right foot right now, last week when you start the numbness again, do you feel hot on the feet?
No.
No, okay. Then it can be, do you do any exercise or you go to travel or you lift heavy thing recently?
It's nothing of that sort lah. It's more like I think my right foot tend to have a lot of problems. So last time got one period got the plantar
Fasciitis.
fasciitis.
I see.
So the pain came back also, but I went
I
to
see.
make them insole, so I hope it correct the problem.
I see.
But the numbness still happens when I walk.
I see. Okay. Okay. So maybe the decompression maybe is still not fully healed yet. And the decompression it will come a little bit later. But for the past 6 months, right? Did anyone say you look better, look younger?
Not really lah, but I think the
Ah.
complexion better lah. Complexion is better.
No one say My goodness. Yeah lah.
No one
Now.
say, but
Okay.
I think for myself, the complexion seems to be
Okay.
better.
That's good. Do you find that you can walk faster?
Cannot already. Now cannot walk already.
Okay, but before this 1-2 weeks where the pain recur again, right? Do you find that after few months of patching, you can walk faster, you can walk longer, you can go up the staircase?
Yeah, got more energy lah. Got
Okay.
more
Okay.
energy, feel
Very good. Okay.
warmer, nails stronger.
Okay. So if all these results you have seen, the nail graining stronger, body feel warmer, can walk faster, can walk up the staircase, look better, you are on the right track already. So I believe now it can be healing crisis provided that when you have the numbness, you got a little bit of hot sensation. It means the blood also going there. It might not now, but maybe in the next few days you start to feel, really I can feel a little bit warmness already. Then maybe it's,
And then the back also got some pain.
I see.
That means it's like the first time it happened. It's like
I
that lah.
see.
The pain
I
in the back and then the numbness.
Right,
So I'm
right.
so worried that it's the same thing again.
Don't worry. Unless you go for travel or you lift heavy things or you overuse your body, if not, I think you should be fine. Because overall, you look better, you feel warmer. All these things is on the right track already.
So the spine thing can be helped by the patches?
Sure. I got how many people that do not need to go for surgery for the, not just decompression, no. The sleep disc, the spur, because of the patch, they don't even need to go for surgery already.
Next week, I'm going to see the doctor. So I don't know
Okay.
whether, should I go for
I tell
MRI, whatever?
I tell you, if you ask me, I wouldn't ask you to go for see a doctor.
Don't see a doctor.
Don't see a doctor.
Wait for the patch to work.
Wait for the patch. For sure, it's already working already. It's not waiting, it's already
Can
working.
use more or not, X39?
Okay, you can put the one additional X39 at the point of pain.
Point of pain,
Yeah.
Not at the lumbar spine there.
Yeah, you really at the lumbar point, but you have to find someone who know how to pinpoint the pain. That means because when you have all kind of sciatica pain or sort, right? We all think that it's the leg numbness. We try to find the pain spot on the leg, but actually it's the decompression area. So
it's on the L4-5 that part.
Yeah, so at your L4-L5, right, those area left and right of the spine, right, you try to press. The area where you feel really discomfort or pain, you put the additional X39 over there.
That means don't put on the foot, right? That's numb.
Yeah.
Okay.
Okay.
Can.
Thank you. Okay, welcome.
Okay, thank you.
Guys, you see, we talk about 2 hours already. Everyone say got result. Even some people, they will say, how come I put the patch already, I got pain come back, but my constipation disappear already. how come I put the patch already? I wake up at 2. But my nail grows stronger already. My leg got strength already. I can speak better already. I got a stroke. How come people like this? How come I got numbness again? But I look better. I nail grows stronger. My body feel warmer. You see, the key is not. I want you to have a holistic way to analyze things. Okay, there's nothing is perfect. If you want to grow a durian, right? When you put the fertilizer, you will feel smelly, right? But it grow. So there is no perfect situation, right? So what I want you to know that the possibility when you look at the bright side of life. Okay. Doctor say I have 3 months life. If not, do not visit A&E immediately. But now I already after more than 6 months. Amazing. Jameson, I'm so happy for your for this. But remember this, guys. Reverence is important. That means I don't want you to feel that I become Superman. Because sometimes, right, it's just that when you have this inflated confidence, then something bad happen already. So Jameson, I really want you now, really cherish the health right now. Really sleep well. Do sunlighting, learn some meditation. If you are okay with meditation, I know some Christian they don't. Try to do things that to preserve the health rather than start enjoying the health right now. I mean, you because now you start to have a basic right now already. You feel better. You don't need to go and A&E. But here, then you continue to learn about health. Like you go to Ping Shuai Gong, you go and under the sunlight, you go meditation, you learn about breathing, you learn about how to use yoga pose to strengthen your spine. So you have to what do you call You have to 乘胜追击, want to go even better. Okay. Okay, hi Karma. Jinlong said I can collect brochure from you. Karma, Christine. Karma. Jinlong, you asked to pack carnosine, ion third eye glutathione, right? Eyes not much. You asked to pack carnosine left. Ion. Hey, Zoom, are you still here? Zoom left already. Oh, but anyway, all this thing is oh, okay. Christine, don't worry. We come again, okay? Oh, I see. Oh, this is the Irina. I see. Thank you so much. Thank you, Irene. I used to need nap in the afternoon, but now no more. I didn't know it's because of my kidney. No wonder my EG5 is normal right now. Kamal, have you seen the Su Hui message? He used to have need nap in the afternoon, but now no more. He didn't know it's because of the kidney. So now he don't have to take nap already. No wonder the EGF are normal now. Guys, do you think it's really a teachable knowledge about health? Just now as I speak, right? So the super say, yeah, no wonder last time I always think that it's because my kidney not good, my EGFR is low. But now I don't take naps already. My EGFR really become normal already. Do you think that this is something is really teachable? It's really transferable knowledge? If you yes, you type 555. It's really transferable. It's teachable. It's not so complicated, but the doctors want to make it sound so complicated until they themselves also don't understand. My friend asking why her friend after using the pad start to itch. Okay, if she used to have skin problem, possible. Strike while iron is hot. You are right. I will talk about my sleep next week if I got. Oh sure. Is it normal I don't sweat after exercise while I stroke? You are wrong. It means that the digestion not so good yet. The digestion not so good. But Simpson, make sure you take more white rice. Okay, if you don't sweat after exercise, something is wrong.
Okay. Thank you.
Take care. Okay. Zoom user, you think about the issue one. Can you come again? Because you asked the question 9:38, be too late already. Okay, come next week. Guys, thank you so much. You see today how many story, huh? How many story? All the stories is here for you to know that there's always hope. With clarity, we always get what we want. Okay, I am a testament to tell you, if you have clarity, no matter where you're starting from, the clarity means that you know the direction. If you know the direction, it's just a matter of time. It might not as fast as you thought, but you will eventually get there if you have a clarity. But the problem is, if you don't have the clarity, you don't know where to go. Even you can walk very fast. You have a most expensive therapy, most customizable technological injection. You move to the wrong place, right? So guys, this is why clarity is most important. This is what we have been doing every night. Okay, another week to... Oh, I forgot to share about the big announcement. Oh my goodness, I'm so sorry. Okay, guys, I need to make an announcement, okay? For LifeWave Malaysia and Singapore, I believe most of you already know already. Okay, so our country manager from LifeWave Malaysia and Singapore has resigned, and his name is Mr. Kesihatan. So his last day will be 29th of August. Will be 29th of August. Okay, it's really not a easy thing for us to digest because he has been with us since the very beginning. He see how us we grew from nothing to become, you know, we got so many recognition from the market, right? So we wish him all the best. But if you want to know why he wanted to leave, is because 20 over years ago he started Amway in Vietnam. So a lot of people has helped him during that time, and now in Vietnam there are some issue because the business is not doing so well. It's not doing so well. So and they asked for Casey for help. Even the boss really come to talk to Casey, seek for his help. So Casey think that it's a time for him to repay back the help, the kindness that they have given to them when he was still a young boy, and now he's only 50 years old. So he think that it's a good chance for him to take this opportunity to create something for them. Okay, so we wish him all the best. So on 29th of August is his last day. On 30th of August is the farewell lunch that we organize for him. Okay, it's a so I will send you the Google form right now in case you want to participate in our farewell lunch to say thank you to Casey in person. Okay, so you can use this link. Okay, you can use this link, and then we will contact you to send you the link for you to pay for the meal. It is a lunch in KL Bangsa and it's 75 ringgit. Okay. Okay, guys, that is all for the announcement. Thank you, guys. Good night. Good night. Good night. Take care. Bye bye.